if you don't want to be on the recording. So
I better put on a nicer shirt.
Tim?
come as you are, right?
No,
And I
it's
do
the
wanna
dress shirt up top and the shorts on the bottom. Right? Pajama
Right.
bottoms and the dress shirt.
That's the Zoom way.
Yeah.
I do want to take the time to mention that the league is nonpartisan and that it does not support, oppose any political party or candidate. However, it does take action on public issues based on positions reached by member consensus, such as this, doing something on the status or of mental health on the Palouse, the beginning of the conversation, and we labeled it as such because particularly in these times of COVID, it seems as though mental health is really rising front and center. Lots of people are dealing with issues that are being compounded and exasperated by the current situation, which isn't to say that mental health isn't always important, even in times of non-pandemic situations. And I really feel strongly about this particular topic. We had in our own family, we had a mental health crisis a couple of years ago, and just the whole not knowing where to start, not knowing the right verbiage to use, not knowing where are those resources, and realizing that it affected our whole family, and quickly became something that I became very passionate about. So I appreciate that the League of Women Voters has given me an outlet for sharing this information and having someone come and talk to us about where we are with mental health on the Palouse, where resources are. And a lot of what I find is with most situations, you end up going to who you know for the information. And that's with the mental health, when you're looking for mental health answers or where do you go to get help, a lot of times it's hard to know who might have those answers. And a lot of that is because there still tends to be a stigma associated with mental health. And somehow some people look at it like it's a character flaw, which it isn't. It's part of your health. Mental health is health. And so one of the things I did find in terms of resources is when I was more willing to open up to people and say the issues that we were having, I found other people, a huge ponderance of people who were like, oh yeah, I deal with that. Or, oh yeah, I know this person and they're dealing with this. So I was able, when you stop feeling that stigma, you're able to connect to more people and get more resources. So that's my little spiel for that and kind of how I got here to moderate this. We will be also putting up on the League of Women Voters page a list of resources that we have gathered for what's available. Yes, there's the other day, just in my mail, I got this mailer from Whitman County Board of County Commissioners. And I started realizing when you start looking and noticing things, you'll notice that there is a lot of resources available on the Palouse, and they are getting the word out, but oftentimes I think we tend to gloss over them when it's not something that we're aware of needing as much. So we are going to list some of those resources that are available, and I think our speakers may talk about some of those resources as well. So at this point, I want to introduce our two speakers and let them introduce themselves and take off.
Kat, could I interject? Could everyone mute themselves, or could you mute them so that we don't have any interruption to the speakers?
Hi.
And then people can add chat and write their questions as they go along, and we'll pick them up at the end or when it works.
Okay. I've muted everybody, but I am going to unmute our guests, who are Leslie Robison, who works with Palouse Medical, and, okay, sorry, maybe. Okay, Leslie, go ahead and unmute yourself if you can.
Got it.
Thank you. And Sarah Ryle, who
Mhm.
works at the hospital, Pullman Regional Hospital. So
Good
I will,
afternoon.
what?
I said, good afternoon.
I will turn it over to our two speakers.
So the initial template was that one of us would talk and then the other one would talk, and it would be this nice organized thing. Sarah and I can't do that. We're not that capable. We will it'll probably be more of a dialogue between the two of us. But I so appreciate the willingness of the League of Women Voters to take this on. Mental health is, I always say, it's not sexy. It's ugly, it's gritty, it's the thing we don't like to talk about. And it's interesting to me because I'll say, as a psychologist, I have found that people have different rules for their body if the organ that is affected is below the neck or above the neck. If it's below the neck, we can go to the doctor, we can get help, we can take medication, and everything above the neck is apparently completely under your control. So if someone had diabetes, you'd be like, are you going to take insulin? Well, yes, of course I am. Okay, well, that's your pancreas and your liver. Are you going to, what about when your brain? Oh no, medications are evil. They're taking my control away from me. Only weak people take medications. I don't want to get addicted. But the rules for our bodies above the neck and below the neck are very different. And so I usually, if I'm trying to challenge assumptions that people hold, I ask them about if it was high blood pressure or if it was diabetes, would they use that same language?
Mhm.
And usually they're like, well, no. And then they look at me and go, oh. And then they realize they've trapped themselves, which is a wonderful thing. But one of the things I first wanted to kind of get you thinking on, as Sarah and I were talking, is this stigma attached with mental health. And I want you to think in your head about what depression looks like. I want you to think about who gets depressed. I want you to think about what that person physically looks like. What actions are they taking? What are they wearing? So you have the intellectual side of you that's saying it could look like anyone, but then there's that personal response of you that may be thinking the person is curled up on the couch. They're not able to do anything. They're sobbing. They're feeling sorry for themselves. They're not able to get anything done. And I want to point out that that is actually, I don't think I really see that image of depression.
Mhm.
I will see depression as the university professor who is teaching full time and has a full load and is dressed every day and goes to work and participates in meetings and then goes home and sits on the couch and doesn't move.
Mhm.
The person who is so anxious that when they're sitting in a meeting, they have to take a propranolol in order to talk in the meeting, but you don't see it on them. So think about what your own images are. Could it be your spouse? Could it be your partner? Does depression look like your son or daughter? Okay, well, it could look like the neighbor's son or daughter. That makes more sense, but it couldn't look like my son or daughter. What actions would you identify as problematic? Does it have to be missing work? Does it have to be drinking? Does it have to be sitting and sobbing? What about the person who gets depression and who's an irritable butthead?
Mhm.
So go
Typically,
ahead, Sarah.
typically men fall under that category more so than women.
Yeah. And so one of the things that I guess to start this is when we look at stigma, we do a really good job of identifying other people's biases. And we don't like to think we hold them ourselves. And if you don't think you hold any biases, you need to look in the mirror and have an honest discussion with yourself, because you probably do.
Mhm.
I will tell you, after doing this for 25 years, I can look at someone who comes in and then still be jaw-dropped about the issues they're telling me because they don't look it. They don't sound it. They're very successful. You know, even I'll come the image of we always think of the drug user is, you know, desolate, they're homeless, they're in the gutter, they're carrying the brown paper bag, or they've got, you know, needle marks up and down their arm. I don't see that a lot. Not in this community. We are a really high functioning community. And the challenge is that people who are very high functioning can also keep things very hidden. So your thoughts, Sarah, on this?
Well, I would certainly agree with you, Leslie, on all of that. I mean, there is a proportion of our community that has some of those issues who fit the stereotypes, but the majority of the people don't. And I think that, as Kat said earlier, that you would be surprised once you start talking about this to find out that your neighbor struggles, their children struggle, you know, that your sister is having problems, but because of the stigma, we don't talk about it.
I have seen, and you've probably seen this too, Sarah, in the ER, I've run into, you know, a college student who comes in the middle of the night, and they're having anxiety, they're having panic, something like this. And I'll say, anybody in your family have this? I don't know.
Right.
And then they're like, we're going to call your parents. And they call, and then you hear mom say, oh yeah, I've had a history of this since right after you were born. And I take this medication and works really well. And their child has never known. In my house, we lay it all out on the table. I mean, my husband has anxiety, and we're like, yeah, dad's twitchy again. You taking your, like, I threatened if my husband stopped his meds, I would compost him in front of the children. Now they threaten him. Dad, did you take your meds? You're a little twitchy. It's right out on the table in our house, just like everything else, because it's not bad. It's just who we are.
I think back, Leslie, I think back to when I was a little kid and hearing my parents whisper about, you know, he has the C. And nowadays, it's not anything for us to talk about cancer, but we're still there with mental illness. We're still there with feeling that it is, as Kat said, a moral deficit, you know, that I'm not good enough because of this. But you wouldn't say that if you had, you know, cardiac issues. It's not necessarily because you're not good enough. Your body might not be good enough right now, but we don't take that as a personal affront. And so it's very frustrating. You know, I used to talk to people all the time about going into treatment, and I'd say, if you had a heart problem, would you go to a cardiologist? This tags onto yours, Leslie. And they'd say, well, of course I would. So you have a mental issue, you can go to a psychiatrist? Well, no.
So one of the challenges is that we, everybody has difficulties at some point in time. If you are sunshine and lollipops and happy dancing unicorns all the time, there are meds for that because that's not normal. Like, we normally have ups and downs in our mood. One of the barriers to getting help, though, is that people believe they have to be down all the time. Okay, so when we think of depression, the actual diagnostic criteria is that you're down more days than not for a 2-week period. And the way I equate it, it's like a haircut. Okay, like, you know, the day you get your haircut, you're about to go in, that's the day your hair works. But before that haircut, it's been driving you absolutely nuts. Okay, so the day you go in, the day you have an appointment with a counselor, the day you're going to go talk to your primary care doctor, you're feeling fine. So it's not a problem. And unfortunately, with mental health, that feeds into our own stigma and prevents us from getting help, because our image is, if we're depressed, we have to be depressed all the time. And the criteria, once again, is more days than not. And that's what I talk about with people, is that's when you get help. That's a time when you're talking to someone, it's, well, yeah, we're having a bad day. Are you having more bad days than good days? It doesn't have to be, you don't have to be suicidal in the depths of hell to get help. But if that ratio is off, more bad days than not, more of the day is bad than not, if you're having most mornings are horrible and it gets better throughout the day, that's maybe a time to talk to somebody. Unfortunately, people wait until they're suicidal, until they can't go on, until they're having work problems, something along those lines. But I think sometimes what happens with a lot of mental health issues too is, as they progress, we isolate.
Circle
And so
back.
this makes COVID challenging because we're supposed to isolate, right? So how do you know when someone's isolating and someone's mental health isolating? I don't know. Any thoughts on that, Sarah?
I think that's very difficult to tell right now, because again, people are going to cover, because what we are very good about is presenting our best selves in those moments when we do have interactions with people. So I think that if you're concerned about someone who might be isolating due to mental health versus isolating for protection, is to ask some more pointed questions about how their days are going and what are you doing with your time? Because I think that is a helpful indication of how someone's doing.
And Zoom, as wonderful as it is, and as much as it can be the bane of my existence at times, it is not the same.
No.
There is something about human interaction that helps us. And actually, we find that depression skyrockets when there are fewer than 2 people in your life that you're talking to. There is a magic number. It's kind of like that 2.3 children or whatever, and a dog and a fence. There is 2 people that are needed in your life to help decrease depression. And when we look then of how do you identify somebody who's getting help or needs help, is one, just reaching out. If you have somebody who is not connecting or is brushing you off, or you hear it, you are all, I recognize a lot of the names, are very well connected people. And the worst that happens is someone says, that's kind of a private question, I don't want to answer that. I get told I'm nosy all the time. Oh, well. I'd rather be nosy. And then I just tell people I don't have great boundaries. You know, or my favorite one is, I'm sorry that I love you.
Yes, that, because people can get offended by this, and if they're not depressed or having more bad days than good days, they might be like, well, what do you think's wrong with me? And in the long run, I think they're going to be gracious about it, that you care that much about them. And the person who is having more bad days than good days, hopefully that will give them cause to think about that someone cares about them enough to ask.
And right now with COVID, it is pivotal that we are asking.
Yes.
If we look at depression numbers, 3 times of what's normal. So how many people are on this thing right now? Like what?
29.
29? Okay, so we're talking normally, we would have 3 people in this group who would probably be depressed or anxious. Right now, statistically, we're talking closer to 10.
Mm-hmm.
So I want you to count out, pick your 10 people with the camera you're looking at. Pick your 10 who are depressed. Which 10 are you going to pick? Are you going to pick yourself? Who on this camera looks depressed?
You do, Leslie.
I know, I can work it. So who looks depressed? Who looks anxious? But realize that there could be at least 10 of you. Now, if we want to make this a little more complicated and throw like Barbara Hammond and Lennis Watts under the bus here, healthcare providers, 45%
Mm-hmm.
are showing difficulties with post-traumatic stress, anxiety, and depression.
Mm-hmm.
45%. We have approximately like 10 providers here at Palouse Medical. That's 10 of them.
Mm-hmm.
So which one are you going to pick, Lennis or Barbara? Which one gets it? Which one looks it? I know them both, so I like to. And so realize that these numbers are exponential, and it's not going to go away because we get a vaccine.
Mm-hmm.
Families have been markedly affected by this. I heard someone saying earlier that I think Minnie was saying that I'm hearing families not going to be together for Thanksgiving. I'm kind of beside myself because my son is not going to be home for Thanksgiving. And we're doing that so he can, you know, isolate for Christmas. Because we decided as a family that was more important for us.
Mm-hmm.
So realize that these numbers are through the roof, but reaching out is also harder right now. It's really hard. I'll kind of give you a little personal thing. This is the way you're going to get this. You know how most of us with our computers, if we don't have enough bandwidth, right? And the screens go all fuzzy. I feel in life right now that in every single one of my connections, I'm not strong enough. I'm either freezing the visual, my audio's clicking in and out, and that I don't have enough bandwidth in any of these areas because all of them are taking more energy.
Mm-hmm.
All of them. Takes more energy to go to the grocery store. I can't just walk into work. I can't just go to the restroom at work. If I'm going to go to the restroom at work, I have to put my mask on and I'm like washing my hands for 25 minutes just in between appointments. Okay. Everything is more exhausting.
Mm-hmm.
So then the next thing, and you're going to have to let Sarah and I know on time about what's the next step if you find you need help. And I guess, Sarah, that's more your forte than mine. You know all those resources.
Well, you know, one of the things that's really awesome about what's going on with healthcare right now is the transformation of care. And it's one of the reasons that Leslie's at Palouse Medical now, and that there's a clinical social worker at Pullman Family Medicine. So it makes it easier for people to reach out and get assessed in that regard without having to reach crisis, because we talked about most people don't reach out until they're in crisis. And when you reach out in crisis, that's a whole nother story. That's coming to the ER. That's having the police come to your home because you're at risk for harming yourself or someone else, or you're gravely disabled. So there are lots of options now if you're able and willing to talk to your primary care. And they're going to go, oh, hang on a minute, Leslie, can you help me? And, you know, a lot of things that you can do is you can look on your insurance's website to see who in your area is contracted with your insurance to provide some assessments, and you can go to those folks and much like Leslie will do is make a recommendation to your primary care about what she thinks is going on and what might benefit you. And a lot of times it is at least medications to start. But of course there are other things that you can do. You know.
There are tons of things to do, and there's a lot of self-help books. And when we look, you know, we have a strong clergy, very well-trained clergy in Pullman. So there's that support as well. We have AA communities, and Pullman is small enough that I say there is no such thing as, you know, 6 degrees of separation. If you're from Pullman, you can be connected to anybody in 3.
Yeah.
Anybody. It's actually kind of freaky. Like, you're like, oh yeah, I know somebody there because they did their graduate work here and then they went to North Carolina and then they were on a postdoc with somebody who's now in England. Yeah, I know them. It's the Pullman phenomenon. You know, I've been here probably longer than all of you. Yes, I've been here for a bazillion years. I was born here. And so I can pretty much connect to all of you. Give me like 3 minutes and I can find your family history, who your kids are and where you were from. But that's the advantage of Pullman. We have those connections. And if anybody, if you use them, that's great. Clergy, major source of support. Self-help books, major source of support. There is yoga, meditation, mindfulness, music. Therapy, traditional therapy with someone like me or the ER that's only like one avenue.
Right.
And it's not for everybody.
Mm-hmm.
Definitely not for everybody. So I think friends are typically the best therapists ever. My husband, I'll tell you a really inappropriate story. I was really anxious about something with the kids. And he looks at me and he goes, you just need to stop. Well, that was supportive, but he goes, you just need to stop. He says, anxiety in this relationship is my domain and not yours. Your job is to sit there and look nice. So just stop worrying.
I hadn't heard that story, Leslie.
Oddly, it helped. I was fine. He's a great therapist for my style, but that's not everybody else's. WSU does the mental first aid, and thank you, Nathan, the mental health first aid. The city of Pullman does mental health first aid. There is the hotlines through Palouse River Counseling. There's national suicide hotlines. ATVP has a hotline. RER has something. WSU has a counseling center. WSU also has EAP services. Right now, I'm also thinking there's free clinic up at WSU, a cost limited one. We have Chaz clinics over in Moscow or down in the valley. We have an abundance of services, rural resources, council on aging.
I want to put a shout out for the Latah Recovery Center too, that is a peer-run program over in Moscow that really helps people who are struggling either with mental health or substance abuse or both.
And there's also Inland Oasis.
Right. Oh, thank you, Leslie.
Inland Oasis, for those of you who don't know, is more of a gender diversity and health. There's NAMI. There's, what are all the other ones on that, Sarah? NAMI and...
Well, there's Pammy and Lammy for Pullman and Latah. But yeah, there are all kinds of resources to reach out to. Leslie, you pulled some out that I didn't even think of. I'm so impressed. Oh, yep. And University of Idaho, thank you, Tori, does first aid also. Mental health.
Yeah.
first aid.
Leslie?
And yes.
You and Sarah are doing a great job of watching the chat for ones that have come to everybody. I've had a couple that came into me specifically. One person asked, these are unprecedented times and people who are normally fairly stable are even having issues. Do you have recommendations for assisting people when social activities might be the normal coping strategies and people are dealing with depression and anxiety, maybe for the first time?
I think that's more actually the norm. And I think, okay, so one of my first things is we need to realize, and this is going to sound dumb, we're in a pandemic. Okay, we are in a pandemic and people forget that we're in a pandemic. And I will tell you, okay, my little side note on social media. Think if someone gets diagnosed with cancer, okay? What do you see on social media? Breast cancer. I am woman, hear me roar. I'm gonna meditate. I'm gonna join a Susan Come march, gonna shave my head with friends and we're gonna win. I get patients come in and say, I'm scared. I think something's wrong with me.
Mhm.
Okay, that's actually a normal response. The I am woman, hear me roar is not a normal response. That's what I call a super coper. Like, that's just not typical. It's fantastic if you can do it, but unfortunately, social media has set out this criteria or this standard of what coping looks like. And coping during a pandemic apparently means learning Mandarin, taking up wood carving, and losing that 30 pounds and reorganizing your attic. No, we call that mania. That is not normal.
Mm-mm.
And so part of it is looking at the expectations we have of ourselves and realizing once again, we are in a pandemic. And someone mentioned, I think Leah mentioned spoon theory, which most of you had heard, kind of an idea is like, our gas tanks are running low. We have a lot of energy that is going out to maintaining daily functioning. So I come back to basics. You got to make sure you're sleeping. Got to make sure you're eating healthy. You've got to limit alcohol consumption. More people, alcohol consumption has gone through the roof.
Mhm.
And I tell people, you got to get up and get dressed every day. I don't care if it's fresh pajamas, but you get changed and in something new every day. Physical activity is essential for people who do not want antidepressants or things like that. Actually, the research shows that exercise on a daily basis, and I'm not talking these like till I'm dripping sweat, I'm talking getting active for 20 to 30 minutes a day is equivalent to an antidepressant. Having a routine. Think about what you would do with your kids if you have kids. Making a routine helps. Exercise, diet, sleep, and making sure you're socially connecting with someone a few times a week.
Mhm.
The other day when we got that really good snowfall, I am out in a mask, in my toque, bundled to the nines, out with a friend walking a dog, and we're on the Chipman Trail, apart from each other, facing forward, and we walked for an hour and a half. I came back absolutely drenched and much better.
Mhm.
We still can do social connection. You just have to think about it, of how you're going to do it. But it is essential, and it's only limited by your creativity.
Mhm.
And like I'm saying, we get in these loops that this is the way I have to do it. And if I can't do it this way, I can't do it. That gets people stuck more than anything.
Exactly.
Anything else on that, Sarah, that you can think of with, sorry, I can talk nonstop if you haven't
I
noticed.
know.
You
No,
talk about, what would you recommend with like the COVID stuff?
Well, I think that just maintaining that flexibility of how to stay connected is so important. You know, phone calls are great. I Zoom with a couple of my friends that I don't get to see. You know, I haven't been able to go visit people the way I would like to. So, you know, we have lunch together in terms of on Zoom so that we can talk and feel as most normal as we can. And I think these are trying times, and you need to just be flexible as to how you can do things and not be stuck in that rut. So that's what I would add.
I think we're going to know what to do during a pandemic the next time.
Oh, please God, no.
No, but I think that's also giving ourselves some grace.
Yes, yes.
Like, none of us know how to do a pandemic. And I hear people, like, we had a discussion in our house and my dad's going off on something and, you know, my husband's going off on something, and they're talking about schools. And I just am like, I can't get mad. I can't spend my energy getting mad about how people are handling pandemics. I have to believe that people have the best intention in mind, and we're all trying, and none of us know what the heck we're doing.
Exactly. So I just thought of a couple of things, Leslie, that I want to
Go for it.
Using humor, having humor in your life. When you talk about listening to music, think about what kind of music you're listening to. You know, is it the kind that's going to drag you down farther, or is
Lifetime movies.
it? Yes. Yeah, exactly. You know, think about what you're setting yourself up for is the other thing. You know, surround yourself with good.
Yeah.
I have another question here. Would you speak to the importance of addressing depression and anxiety in young people, indication of possible other problems that can develop?
That's huge.
I'll tell you, one of the first things I learned working inpatient acute psych was when I would go down to the ER to assess somebody with anxiety, particularly a young person. My first question, one of my first questions, not my first, is how much caffeine do you drink a day?
Lots.
And for, unfortunately for these young people, they were drinking, you know, 5 or 6 monster drinks a day or whatever the one is. Yeah, I know.
That makes my kidneys hurt.
I know. But yeah, and so Leslie, take it away. That just quickly came to mind.
And also, I think I was actually talking with someone about this the other day, because as we're talking about the vaccine, I think culturally in the United States right now, we're a very quick fix society. We want our vaccine, and like, oh, preach on, I want the vaccine. Behavior change is very uncomfortable for our country, for many people. Diabetes requires lifestyle change. Teenagers are just trying to figure out the life they want, like what they want to do. And now we're asking them to do it differently. And I think as a society, as many people say they don't want meds, they want the quick fix. We want to, if we're going to lose weight, we want to lose 10 pounds in this week. We want to feel better now. These things, if someone hasn't responded to a text in 5 minutes, we're like, well, where are they? Why aren't they answering? And I think with younger folks too, who live with these things, that distress tolerance and frustration tolerance and tolerating discomfort is harder.
Mhm.
So we see higher amounts of pot use. We see higher amounts of recreational substance use.
Mhm.
We're seeing a lot more self-harming type behaviors. Lennis can actually probably speak to some of this stuff of what you see with adolescents, but it seems to me like we're seeing a lot more of that. I don't know, any thoughts on that, Lennis?
Well, I think, you know, the things that adolescents usually do, they can't do. You know, they are just stuck. And there's enough going on in adolescence anyway. And now with so much of their life is social interactions, and now you know, Zoom just doesn't do it, and so they're not motivated to do their schoolwork. They're not motivated to be really engaged in their classes. And those kids who already have underlying propensity for anxiety, that so they say they, you know, have told me at the office they're seeing many more eating disorders. You know, just they're just trying to get a handle, trying to take some control somewhere because they don't like this control. You know, they don't like this world that they're in right now. So,
And I think it's hard too, because as a parent, I don't want my kid to be uncomfortable.
right, right.
And so many parents will, I've heard this many times, tell an adolescent they're not old enough to be depressed.
Oh, yeah.
What do they have to be anxious about? That can't, I hear this about sexuality. Well, you're too young to know.
Yeah.
You can't know who you're attracted to. You're only 15. Okay. So the hard part is that the kids are also their biggest support for each other. As much as we would like to think as parents that we are the major influence, we're not. So they reach out to each other. And so one of the best ways I think that we can help our young people is by, as parents or as adults, is educating them and making sure they have accurate information and they know about the resources. I have found it's funny with my oldest son. I will, and Lennis knows him, so I will tell Jacob something about resources and I get the complete eye roll and the kind of the my mom's an idiot
Yeah.
look, which most of us know at some point in time. And then I have heard him on more than one occasion on the phone, dude, you just need to. And he spews what I've said. And that I feel is an effective intervention.
Mhm.
So it's the conversations we're willing to have with each other that enable further conversations to happen. And as long as we keep talking, that is essential. Totally essential.
Mhm.
I just learned something with my son, who Leslie knows, who doesn't talk much. But I called him at school and I said, I'm just kind of checking in. I don't know how you're feeling. How are you feeling? And he's like, I'm feeling fine. What are you talking about? But a couple days later, he called me back and he said, you know, he said, I'm really not feeling fine.
You opened the door, Lennis.
Yeah, you know, and I wasn't even thinking that much about it. But, and so I did that non-good COVID thing, but I did are you getting outside? You know, you have to be outside.
Yes.
Mhm.
And, and how are you eating? And how are you sleeping? And then I gave him permission to play basketball, which is what he really needed to do was to play pickup basketball, which is not, you know, the safest COVID activity, but sometimes you have to choose, you
Mhm.
know.
My kids play hockey. My kid who's here plays hockey, and the poor kid has a mask that attaches to his helmet because I'm that mom. And I told my kids, I'm that mom. And my kids, both of my kids' response is, you mean you're that mom who cares about people's health? I was like, oh, okay. But I think it's part of this is what kind of we've spoken with Kat is that, and I think what Kat's going for is we can have all the resources in the world. We can think we know what to do. We believe when people don't know what to do, they call me. Like, I don't know what to do. I'm going to call Leslie. I don't know what to do half the time. I don't know. But what I'm willing to do is talk and listen. You want to know what to do? Talk and listen. I'm not saying tell people what to do. Talk to people, connect, listen to them. Listen with your heart. Don't listen intellectually. Listen to people and keep the conversations open. If you want to help people, listen and talk to them. That is not a phone number that you need. There is not a skill set that you need. There is not a treatment algorithm. There's not a medication. You want to know what the healthiest thing to do is talk and listen.
Leslie, can you explain the difference between psychologists, psychiatrists, and counselors and what's available for each of these on the Palouse and how to navigate between these mental health resources and your primary care physician?
Okay, a
In 10
psychiatrist,
words or less.
yeah, psychiatrist is a medical provider. They can prescribe medication. We don't really have those on the Palouse. We have one part-time person. That's it. You're talking about 6 months to get in. They have them down at Tri-State in Lewiston or a Tri-State. And then to get in at Kootenai up in Coeur d'Alene, you're about 1.5 years wait. You're, go ahead.
Doesn't Gritman have a psychiatrist now, Dr. Germain?
No, she's left.
Oh, she left. Okay. Thank
Yeah.
you.
I'm not sure if she left or she retired,
Okay.
but she's now gone. So we do not really have anyone. And I don't know if the hospital has locums. Do you know,
No,
Sarah?
no.
They do have a telepsychiatry that comes in the case of emergencies or if you're hospitalized.
Correct.
Psychologists, counselors, therapists, psychologists just tend to have a doctorate, a PhD. We don't prescribe. So psychologists, counselors, therapists, social workers, licensed clinical social workers. There's other labels out there, life coaches. We do talk therapy. No meds. We usually will refer someone if we believe they need meds. There is, I would say your primary care doctors are very well versed, considering about 50% of primary care is actually psych, a really high a disproportionate amount. Our primary care docs in Palouse Medical have started going to psychiatry meetings to get more training. There's really no difference in outcome in the research between outcome with psychologists, counselors, social workers. It's really not. It's just about finding the person that you can connect with. And it's also just a matter of their background. Providers are usually covered with insurance, and you have to figure out which one your insurance will cover. In our community, it's really hard if you have, I think there are very few providers who actually take Medicare. I think I might be one of the only ones, and that's fabulous. And then Kaiser is also very limiting. I think myself and Palouse River Counseling may be the only ones that take Kaiser for counseling. There might be one or two others. And And then Molina, which is the state insurance, I think I am the only one that takes Molina and Palouse River Counseling.
Yeah.
So we have a lot of questions that we probably are going to run out of time for before we get to the end, which we may try to give to you guys to get some answers to those questions that maybe we can post on the website as well. But one of the questions that we kind of have as League of Women Voters is what can the League do, or how can we help keep this conversation going?
I'll let you start, Sarah. Well,
Okay,
I'm dumping it to you so I can.
What can the League do? You know, the League can continue this conversation and continue it within the community and help to, one of the problems with our system, whether it's healthcare, well, mental health is healthcare, excuse me for trying to dissociate that, is the fragmentation. And if we can work towards, there are a lot of resources, but how do people access them easily? What do we do? So those are all important things that the League can help people learn and discover what will be helpful for them. Does that make sense?
I think I'm gonna come back and be simple about this.
Good.
One of the things you can do immediately is think in the next week. What you of the League of Women Voters can do is think about, how am I going to approach somebody in the next week and tell them the talk I went to and see what it generates. Can I engage someone in the next week about a conversation about mental health and COVID? Can I talk with someone in the next week about the stigma of mental health?
Mhm.
We used to sometimes do this in graduate school because psych has a lot of fun little psychobabble. It's like, can you take that word and put it into a conversation? Can you take this topic sometime between now and the beginning of the month and put it into a topic of conversation with someone? I would say one of the biggest strengths that you have is your social connectedness as a
Mhm.
group.
Mhm.
You have far-reaching tendrils. Keep that conversation going or start it. So getting people talking, great at that. You did that today. The
Mhm.
questions on the chat are just, it's like just keeps going and going and going and going.
Mhm.
It's fabulous. So I would challenge you as the League of Women Voters to see if you can continue this conversation with someone outside the League sometime in the next, over the holiday, before now and December 1st. Think about how you would engage in this conversation. That would be my challenge to you, but that's more on a personal challenge. I'd have to think honestly about what the League can do.
Mhm. Mhm.
So,
Well, thank you. And we are getting close to the time. I want to be thoughtful of people's time because I know many people are on their lunch hours. So thank you, Leslie and Sarah, so much for speaking with us and starting the conversation of what we hope will be continued conversations, because it is an issue that requires a continued renewal of constant attention. And so thank you so much for your time with us today. We
thank
really
you.
appreciate it.
Thank you for having us. I appreciate it. I really do.
Mhm.
And thanks to everybody who has, thanks for everybody who has shown up today and come to listen and participate, and all the great comments that people made in the chat back and forth. It looks like you guys there was a lot of great conversations happening there as well, with people sharing information, which we'll also try to include with the wrap up of the the recording on the website. So I am going to unmute everybody.